This gel can be used to protect skin ulcers, burns, or wounds from irritation so that the skin can heal properly. It can also help relieve itching and pain from various skin conditions. The Hyaluronic Na-Allantoin-Aloe gel contains hyaluronate, which is a natural substance found in your body. It works by forming a protective layer over the affected area. It is recommended to apply a thin layer of the gel to the affected area 2 to 3 times a day, or as directed by your doctor. It is best to apply the gel after cleansing the affected area and allowing it to dry. When using this Hyaluronic Na-Allantoin-Aloe gel, it's important to only apply it to the skin. Make sure to wash your hands before and after each use if you are applying the gel with your hands. Clean the affected area before applying the gel, as directed by your doctor. Gently apply a thin layer of the medication to the affected area of skin, usually 2 to 3 times daily. If the product is a liquid suspension, shake the container well before each use. The frequency of application depends on your medical condition and how you respond to the treatment. It's important to use this medication regularly to get the most benefit from it, and try to use it at the same times each day to help you remember. If your condition does not improve or worsens, be sure to inform your doctor. It's important to note that this gel has been prescribed to you because your doctor believes that the benefits outweigh the potential side effects. While many people do not experience serious side effects, it's important to be aware of the possibility. In rare cases, a serious allergic reaction may occur. If you notice symptoms such as rash, itching, swelling, severe dizziness, or trouble breathing, seek medical help immediately. Keep in mind that this is not a complete list of possible side effects. If you experience any other effects, it's best to contact your doctor or pharmacist for guidance. In the US, you can call your doctor for medical advice about side effects, or report them to the FDA. In Canada, you can also seek medical advice from your doctor or report side effects to Health Canada. Before using Hyaluronic Na-Allantoin-Aloe gel, it's important to inform your doctor or pharmacist about any allergies you may have. This product may contain inactive ingredients that could cause allergic reactions or other issues, so it's best to discuss this with your pharmacist. Additionally, before using this medication, be sure to share your medical history with your doctor or pharmacist. If you have an upcoming MRI test, it's crucial to inform the testing personnel that you are using this product. Some brands of this medication may contain metals that could cause serious burns during an MRI, so it's important to seek guidance from your doctor or pharmacist about your specific brand. For pregnant women, it's recommended to use this medication only when it is clearly needed. It's best to discuss the potential risks and benefits with your doctor. Lastly, it's unclear whether this drug passes into breast milk, so it's advisable to consult your doctor before breastfeeding. It's important to be aware of potential drug interactions with Hyaluronic Na-Allantoin-Aloe gel, as they may change how your medications work or increase your risk for serious side effects. Make sure to keep a list of all the products you use and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Additionally, be cautious with certain disinfectants, such as benzalkonium chloride, as they may interact with this gel. Always consult with your healthcare provider before using this product. If this gel is ingested, it can be harmful. If someone has taken too much and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical attention by calling 911 or a poison control center. In the U.S., residents can contact their local poison control center at 1-800-222-1222, and in Canada, residents can reach out to a provincial poison control center. As always, keep this product out of reach of children and pets. It's important not to share this medication with others as it may spread infection. This medication has been prescribed specifically for your current condition, so do not use it later for another skin condition unless instructed to do so by your doctor. Some brands of this medication may also contain other ingredients, such as aloe vera and allantoin, which can help provide moisture and soothe the affected area. If you have any questions about these additional ingredients, be sure to ask your doctor or pharmacist. If you forget to use the Hyaluronic Na-Allantoin-Aloe gel, you can use it as soon as you remember. However, if it's almost time for your next dose, it's better to skip the missed dose and continue with your regular schedule. Avoid taking a double dose to make up for the missed one. Make sure to store this gel at room temperature and keep it away from children and pets. Do not flush it down the toilet or pour it into a drain unless instructed to do so. When the product is expired or no longer needed, make sure to properly discard it by consulting your pharmacist or local waste disposal company. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.